Hello everyone, my name is Riddhi, and I'm one of the speech pathologists here at Network Speech Pathology. Today I'll be providing an overview of the IDDSI framework and the different diet levels used to support people with swallowing difficulties. What is IDDSI? IDDSI stands for the International Dysphagia Diet Standardisation Initiative. It's an internationally recognized framework that standardizes food textures and fluid consistencies. And using consistent terminology basically improves communication and helps to ensure people that receive the safest diet and fluids for their swallowing needs across healthcare settings. We'll start with IDDSI level 7, which is the easy to chew diet. It includes everyday foods that are naturally soft and tender. There are no restrictions on piece size and fluid, and food can be eaten with normal utensils. However, foods that are hard, crunchy, tough, chewy, or stringy should be avoided. The next one is IDDSI level 6, soft and bite-sized. Now, level 6 foods are soft, tender, and moist. Each piece should be bite-sized or no larger than 1.5 centimeters. How I think about it is it should be about the size of an adult thumbnail. The food should squash easily with the side of a fork, and it should not bounce back after being squashed. IDDSI level 6 food should require minimal chewing and should not include bread products. Next, we've got level 5, mince and moist diet. These are finely minced and moist with pieces no larger than 4 millimeters. So they should ideally fit between the prongs of a fork. The food should hold together, squash easily with a fork using very little pressure, and should not separate into liquid and solid. And similarly with the level 6, very little chewing is required. Next, we've got level 4, pureed diet. These are completely smooth diet consistencies with no lumps and require no chewing. They should hold their shape on the spoon and fall off the spoon in one piece when tilted. They should not be sticky, and there should be no liquid separating from the puree. Level 3 is liquidized. Level 3 foods are smooth with no lumps and are thin enough to be drunk from a cup or eaten with a spoon. They should pour easily but still have a thicker consistency than regular fluids. Texture modification. So when preparing texture modified foods, it is important to use the IDDSI fork and spoon tests to ensure correct consistency is being met. These simple tests confirm that food meet the recommended texture and also reduce the risk of choking or aspiration. For more information on the IDDSI framework and testing methods, please visit the IDDSI website. If you have any questions about an individual's diet recommendations, please always consult your speech pathologist. You can also find additional swallowing resources and educational materials on the Network Speech Pathology website. Thank you so much for listening. If you have any questions, please feel free to contact us using the details on the screen. Thank you.